Sounds like you've had a busy day. I've got a busy day over here. So we're going to take this live on Facebook. Hopefully we'll have some more people jump in. But today's discussion is the importance of a sleep care coordinator. Now, tell me this, are you one of the first certified sleep care coordinators? Were you part of that first initial group?
I am. Yeah, I was one of the lucky few that got in for the first certification course. And it's
talk about that. What did that entail for you? Well, I mean, how much experience did you have before that? And then what transpired out of that?
Yeah, so I work for Dr. Rothschild in Durango, Colorado. And we started doing sleep about five and a half years ago. And I just it lit me up. I just had a huge passion for it. I found out that I actually had sleep apnea at our first SGS course before we bought the EchoVision. So that kind of ignited my trail for this this career path that I kind of got just led on. So Dr. Rothschild let me kind of take over our sleep program and just kind of run with it. And we were doing really good, getting good turnover with our patients and good success rates with their oral appliances, getting their AHIs down, getting them off medications, just getting them feeling like a newborn, getting a new life force energy behind them. So I was contacted by Sleep Group and they asked if I wanted to come down to Hollywood for a certification course. And of course I said yes, honored to. And so we did that. And then about a month later, COVID hit, and we were actually one of the few offices in the Four Corners areas that didn't shut down during that time. Dr. Rothschild's on the board at the hospital, and so we were considered one of the lucky few to stay open, but we were actually able to help a lot of patients during that time.
And were you able to stay open because it was essential medicine, or was he given a special permission by the hospital to go forth and take care of patients?
A little bit of both, but mainly because we were essential. And then we were kind of running triage for the hospital to try to keep their numbers down as well in the ER.
So you had mentioned a few things in that context there that struck my ears. One of them was setting therapeutic outcome goals. So I imagine, do you work with doctor on that? When he looks at AHI, he probably looks at more than just an AHI. He thinks about chief complaints. So talk about what's the normal type of patient? What are they struggling with? And then what are they hoping to get out of care?
So I would say probably the majority of our patients who are coming here knowing that they have something going on with them, their chief complaint is their energy. They are dog tired. They are not able to enjoy their family, their lifestyle choice that they prefer. And they just feel like they're running the candle at both ends. They're not able to find the magic fit for them. So they've gone to multiple doctors, different, healthcare providers, and they just keep coming up empty-handed.
Are they coming in diagnosed already? Have they had a sleep study? Are you guys doing sleep studies out of the office primarily, or where are you guys at?
Yeah, I would say probably 50-50 at this point. We've been getting a lot of referrals this year. That referral basis has really picked up. And I'm not exactly sure why or how. I have my theories behind it.
I'll tell you my theory. You want to know my theory?
What's your theory?
My theory is you've gotten results that other people aren't getting, and there's so few providers that are able to achieve what Dr. Rothschild's doing that you've kind of bridged that gap, right? We have this gap between medicine and dentistry, and it's building that structure that connects the two. And we do that through letters. We do it through, mutual patients and follow through. I think that's why dentistry is so poised in dental sleep medicine is there's nobody else that keeps track of people like a dental practice.
That's true.
Because you guys have a hygiene department and you follow patients. That's just how we're trained, right?
Absolutely.
So, and you said it was 5-6 years that Doc's been on this kind of airway journey.
That's correct. Yeah.
Do you I've talked to him, but would you want to share his story? What got you kind of talked about yours? You got diagnosed at a course and then went forward with it. But what's Dr. Rothschild? I know he's been a dentist in Chicago. Now he's out in Durango. But did he carry that from Illinois out to Colorado? Has this been like a lifelong kind of career thing, or did something trigger it? Do you know?
In a sense, he was treating sleep and airway before he knew he was treating sleep and airway. And then what it's like, what you don't know, you don't know, but once you learn it, you can't put that lid on the can of worms anymore. So once he learned something, we just continued to reinvent the wheel. And he was treating patients with, snore guards, night guards, but we really didn't know the extent of what we were treating until we went to our first sleep group solutions seminar. And that's when we got to do the entire, seminar. We had a hands-on approach with the Echo Vision. We all got to test our airways with the rhinometry and the pharyngometry. Doc's wife, Mary, and I actually took the sleep test home that night after the first night, and we both ended up having sleep breathing disorders, upper airway resistance and obstructive sleep apnea. And I never would have guessed. I was in total denial. I was like, oh, I'm fine. I just drink coffee all the time. That's just what I do. Now, if I drink coffee, I'm like I always tell my patients I'm on like a cat on a tin roof. Like if I drink coffee, I'm just all over the place. So it's more of a social thing now than something that I need to keep up with the day, even a busy day in office.
And so did he run everyone through the protocol of getting tested? Like that's our step one, right? When we take a new client into Sleep Group Solutions, that's the first thing we say to do is, learn the ropes, learn how to jump through all the hoops with your team and your team's family, and just see what's out there. Because like yourself, you had no awareness. You don't fit the stereotype, if there was one. Like we kind of have one that's an old fat man, but you're not that. And Mary's not that. And like in your patient population that you see there in Durango, is it mostly males, females? Is it kind of equally split, or?
I would say it's about equally split, and we're really seeing a lot more of the college students come through the office now, and the elderly, which before it was kind of middle-aged through 40s, 30, 40 age range. And now we're seeing, 60, 70-year-olds coming in. That's not elderly. Nobody get mad at me for saying that, but within that age range, and then the younger children and kids who are coming in with sleep breathing disorders.
Talk about the college kids. That one, like it's Fort Lewis in Durango. It's a 2-year or 4-year college?
It's a 4-year college.
4-year college, and it's primarily for what type of kid ends up down there? Someone that likes to ski, obviously, but they're there to learn.
It's more kind of like your liberal arts college, I would say. So they're definitely, more poli-sci students, things of that nature. But they're doing research. Ever since the book Breathe came out by James Nestor, everybody's reading that book. Everybody's listening to it on Audible. And that really just kind of enlightened a whole new community of patients. They're coming in, they're like, oh, I read this book. And I'm like, let me guess what it is. And they're like, you've heard of it? I'm like, definitely have heard of it. Definitely have read it. And just being able to kind of shift, they know that they're coming in on a basis of something that they've read or they heard on Audible, and you already know what they're talking about. It puts them at another comfort level. They know that they're at the right place. They're like, oh, they know what I'm talking about. It's not just me coming into a new office trying to explain something I read on a book, and so they know they just have that different level of comfort zone.
Yeah. So my dad wasn't a dentist. I don't come from a medical family, but I was taught that the first medicine we have is the food we eat. And then I've learned through my career, the second medicine is the air we breathe. And they're probably actually reversed. We take our first breath before we probably have our first meal. But it's just common sense, I think. If we have a good respiratory rate, if we, like in Nestor's book, he talks about the breathing rate should be as low as like 11.5 breaths per minute. And so are these kids, are they mouth taping? Are they trying to slow down respiration? Do they tend to be anxious and depressed? Or like, is it like those were the symptoms I saw with my younger population? So talk about that.
Yeah, I feel like they're definitely more sympathetically upregulated. They're coming in, they've been on medications, whether that be like ADHD or depression meds, anxiety medication. And most of them have been doing on that regimen since they were in middle school. And now they finally have like starting to think outside of the box, get outside intel. And so they're trying to wean themselves off of that medication and go to more of a holistic approach to life, which I think
do you
is
guys
wonderful.
do you teach a breathing technique, or tell me about the practice?
Sometimes we do, we'll like go with different nasal opening, breathe techniques. We definitely have all of our patients start with mouth taping, even before they know that they're getting oral appliance. We'll know in advance, like this patient's definitely going to be needing an oral appliance. So we'll kind of plant the seed with them doing mouth taping after their first visit. We'll send them home with a roll of tape. They go home and they start the mouth taping, and they're getting the nasal passages to bathe better, the sinuses to open up, and just really start that watering that seed of getting them to nasal breathe better and lip seal. So when they do get their oral appliance, they're already ahead of the game. They're not
Are you
worried about, oh, go ahead.
are you teaching saline rinses too, to kind of clean passages out before sleep, or?
Yes, we actually like we started with just like neti pot and like the little squeeze bottle. A lot of our patients, we've had them go and get the Navage, which is kind of the Cadillac of neti pots, you could say. And our patients are just impressed with that. They're very impressed with the difference between a neti pot and a Navage, and the difference of the clearing of the nasal passages.
Tell us about that. Our audience might not be familiar with what that is. You said the Cadillac. So is it powered, or what's different
Yeah,
versus
so
a
it's just,
traditional
it
netting?
does kind of like an electrical suction through, plunge through, instead of just holding the neti pot and letting it gravity flow. The Navage is actually powerful and going through. It's a little more expensive. It's on a couple $100. You can get if you sign up for their coupons, you can definitely get it around like the $100, $150 price tag. But just the outcome that our patients have been having with it, I think it's fully worth it, especially if you're testing the patient and their rhinometry is low, or you're taking a cone beam and you're seeing deviation of the septum or sinus polyps, anything of that nature. I would highly recommend, if they, if they can't afford a Navage, which, it's fine. An neti pot will do. Try the X Clear if you carry that in your office. Any of those options. We even have our patients smell peppermint oil or diffuse peppermint oil by their bedside table, and that helps open up the nasal passages as well. It's a more of a natural decongestant. As you know, we're a holistic office, so all of our patients are game to try anything that's more on the holistic side of things versus just jumping straight into an ENT setting.
Right. We're going to come back to that one, because I want to explore that a little bit further. I think we've talked about it before. I don't know, it's years ago, but talk about the initial visit. Like how much, like since tonight's topic is the importance of sleep care coordinator, how much of it is Bandy and how much of it is doctor? And like, what is your process in your practice? How do you, when a patient comes in, is it specifically for an airway evaluation appointment? Or are you bringing them out of hygiene and then putting them there? Or is everything kind of scheduled so that patient's in the mindset? And then, like you talked about rhinometry, I wouldn't tell anyone to tape their mouth before we assess the nose and the ability to pass air through it. So I think one of the biggest problems is nasal disuse, not so much nasal dysfunction. We've become a habitual mouth breathers, and that doesn't have to be Napoleon Dynamite, where they're like, it can just be as simple as having lips apart.
Yeah, just the tiny little unseal of the lips is definitely, it's a red flag for us. And it's like the cute little like Hollywood pout that is like the new thing, it's like, oh, your lips are gently open, and it's, this popular thing. And I mean, Doc and I are just like, that's not great. Like, this lip seal is beautiful. So when they come in, all of our patients, new comprehensive exam that we do, all of our patients are getting tested with the rhinometry and the pharyngometer. All patients that walk through the door, no matter if they're coming in just for hygiene or for a full comprehensive exam, we're testing everybody. Patients who come in just for a sleep evaluation or airway evaluation, they're bringing with them any further like past testings that they've had, any sleep tests that they've had, any blood work that they've had. We're really jumping into that at their first visit. So if they're coming in, just say like we had a patient today who came in and we already had their 2 previous home sleep tests, or they were in lab sleep tests prior to having a CPAP and then CPAP titration sleep test, and then all of their latest blood work that they had. So they brought all of that with them. They were been on CPAP for several years and they're just exhausted. That's not working for them. They've heard about us from their medical doctor who referred them over. And so we tried the jigs, found different positions, and they're actually a good responder for sleep appliance. So we're going to have them do dual therapy because we don't want to say, you don't need your CPAP anymore. That's not our job to say that. We can tell them that you can have dual therapy. So most patients who have CPAPs, they are waking up in the middle of the night to use the restroom, they're taking the CPAP off, and then they don't want to fight with the octopus going back onto their face. So at least with the dual therapy, they have that oral appliance in their mouth for those early morning hours, which we all know that's when the majority of health happens, health distress. So, but when they come in, that's kind of what we do. Everybody gets that. We also do a cone beam, and we try to do a side-by-side comparison with the rhinometer and the pharyngometer and show them and measure on the cone beam what we're seeing and how it's mirroring and how the echo vision is actually accurate and why we're testing. And if they can see a visual of the graphs and the color, and then they see the cone beam, they're like, oh, that's me. Like, that totally makes sense. I can't breathe out of my left nose.
Yeah. Are you clarifying, are you taking 2 cone beam scans, or you're taking one and then comparing it to baseline?
Taking one cone beam, and then we're kind of just dissecting it through the axis of the oral airway down in the neck. We're measuring that to see how many millimeters wide the neck is, and then looking at the sinuses, deviation of the septum if there is any. And that's
how do patients respond to all this? Because like, this is not your typical dental visit, right?
Yeah, no, it's definitely not your typical dental visit. They're usually blown away about the amount of technology and the amount of time that myself or Tiffany, our other assistant, is spending with them before doc even comes in. I mean, we're asking.
How much time is that? How much time?
Yeah, we schedule our airway evaluations for an hour and a half. That gives us ample time because if they do want to move forward, they already have a sleep test, and they just like, yes, take my money. I want a sleep appliance. How soon can you get it to me? And so we have that time. We have that time period. If not, we have ample time to discuss like in-depth health history. Dr. Rothschild will come in. We spend about 30 minutes with them before he comes in. And then he'll come in, we go and, discuss everything with him before he comes into the op. After he comes in, he spends about another 30 minutes with them, going through everything and just measuring everything out.
And do you get like admin time? Because like I remember, like, I think it was Thursdays or something was always my good day to swing by and catch up with you guys, because that was like your admin morning or day. And there was always donuts. It was always yummy.
There's always food on Thursdays. So we do. I actually did it this morning. But if you can spend 3 to 4 hours, I'm a stickler on getting our primary care physician letters out. I want to update every primary care physician, even if it's a medical doctor that mentioned to them that they may have a sleep disturbance. I want that person's information so I can also send them a letter with a copy of our results from the Echo Vision printout. And if we do a WatchPat 1 or WatchPat 300 sleep test, I want them to have that information, and I want them to know what we've done, like how the patient has increased their health. They were at a patient today. We had a new patient come in, new sleep test come in. 3 months ago, he was at, I think it was a 29.3 AHI, and now he's down to an 8.3. And that's huge. So I worked this morning on getting that out as soon as possible because I wanted that doctor to know that info.
Are you doing that manually, or are you using a software? I know since like we've brought you guys on board, we've added a lot of other components to the package, the business builder for sleep medicine, which has a software that automates that. Are you doing a lot of this manually, or you just kind of set up templates over the years, or are you using a software?
So I just have templates set up through Word that I have saved. And then I have different ones for if is it a follow-up test? Is it a first-time sleep test? Is this how long have they been in their appliance? Are we doing a 1-year follow-up with their oral appliance? Things of that nature. It just kind of depends on which one. But I'll just put in their information, birthday, day, the day we did the sleep test, their name, before and after, just kind of give them a synopsis of what's happened on behalf of this patient. I didn't do it. They did it. It's like the patient did this for themselves. Like, you can give them all the tools in the world, but if they're not advocating and using them in their own time, then it's just not going to work. So giving the patient and their medical doctor the clap of approval for that, it goes much further. Don't take credit for it.
We kind of jumped right into meat of the discussion tonight, but let's back up a little bit. How did you get your start in dentistry, and were you an assistant? Tell us who Bandy is.
Yeah, who's Bandy? So I grew up in a rodeo world, and I was a very active kid. I was rodeoing and gymnastics all the time. I rarely went to a doctor because we just lived in rural middle of America, and I was a terrible sleeper. I never took naps. I had tubes in my ears multiple times a day, or multiple times within my first 3 years of life. It was hectic. It was hard. Really hard to wake up in the morning as a kid, and then never could go to sleep at night. I would toss and turn. I would get maybe 4 or 5 hours of sleep my whole life. And so then I quit the rodeo world because I felt like I needed to be doing more for my health. So I went to massage therapy school and aromatherapy school, and I did that for 15 years. I had a big clientele, did all types of events and did just different activities and stuff with chair massage, sports massage, intermixed with the rodeo world. And I just kind of got an idea. I had a message that I needed to dive deeper into health. And so I started looking into dentistry, and I found an ad for a holistic dentist, and was like, what is that? Like, what is a holistic dentist? So I did my research on Dr. Rothschild. I applied, got the job. I always say I went to Rothschild University because I went and got my certification, but I learned way more training and working with Doc for the last almost 7 years. So I just dove into it. And Dr. Rothschild personally, he's a man of wisdom, and he just never stops learning. We're constantly reinventing the wheel. So when I got into the holistic dentistry, I was here for about a year, and that's when we went into the first sleep group seminar that we went to. And I just lit up because I was like, that is me. That's like, this is the kid that they're talking about.
Where was that seminar? Where did you guys go?
That was in Scottsdale with Dr. Friedberg. And it was great. It was wonderful. It was a really great seminar.
Yeah, we're back to doing some big seminars. We're trying to do East Coast, West Coast, or Central Midwest, and
nice.
two a month, and have them really big numbers like the old days. And so nice. I imagine Faustina may have some stuff. She may have some stuff at the end, but coming up here, we've got Las Vegas in October. Nobody loves going to Vegas, right?
No.
We've got another one in Washington, D.C. in November, and then Dallas, Texas in December. So if anyone's looking for a course to go to that's trying to get into dental sleep medicine, those will be your good bet. And then we also have an in-office version where we're going into offices, and here's some of the stuff right there. So we got New York City, we just had Vegas is coming up, Washington, D.C., Dallas, Hollywood in January, and L.A. in at the end of or middle of February. So thanks, Faustina, for throwing that up. Sleep TV 50 will get you 50% off. We may come back to the end and put that up, but what does it take to be a sleep care coordinator?
It takes a lot, but I think for the right person, it's not a lot. It needs to be, I feel like it needs to be somebody who's very passionate about sleep, whether it's them themselves that has improved their life and their life force energy, if it's their child that they have seen go through kind of the drudges of healthcare, and now they're living a more prosperous life. Everybody will have their personal why story and why it's so passionate and embraces their like just energy for it. But it takes I'm meticulous. I'm all about numbers and organization. I have a Excel spreadsheet that is this long of information. I keep track of all of our patients. I want to know when they first came to our office, when they had their first airway evaluation, when they did their sleep test, what was their outcome of their sleep test, HI, RDI, what was their Epworth score when they first started, when they first came in the door, where were they at with their energy, what medications were they on, how many average hours a night of sleep were they getting. I want to know all those little details about that patient. And each time we do a sleep test, I update that info. So I have a huge kind of encyclopedia of our patients, of what's going on with them, where they're at. I keep track of that. Like I mentioned earlier, the primary care physician letters are important.
You do those like once a week, or do you do a little bit every day, or how are you?
Yeah, I do. I do them once a week. On if you have a day, it's like a half a day or a full day where you can do that. Some days, some weeks you're not going to have as many, but if you stay on top of it, it's not as overwhelming. But definitely do that. You can do 2 to 3 hours for 1 week and have it all done. And then the primary care physicians or any healthcare provider, it doesn't even have to be a PCP, but they know that you're helping that patient and you appreciate their care for that patient as well. It's like you're not trying to overstep boundaries. You want everyone to be on the same team for this patient's well-being. But then just, keeping up on order of mouthpieces, nose pieces, the filters for the rhinometer and the pharyngometer, just making sure that the Echovision is getting its weekly and daily updates that sleep group does for us. We don't even have to do anything, just keep it turned on, and which is great. That's an easy task to do. But also education. I think education is a huge component. We've got to, the sleep world is booming, and more information is coming out. More podcasts are talking about it. More memes are talking about sleep. It's wild. I have like a whole sleep folder saved of just funny memes. But maybe a little nerdiness needs to come with the sleep care coordinator as well. But that's okay. But I think just staying up on education and what's new, what's the newest hip information on sleep. Like if we can stay up on that, and especially with new patients coming in, they heard something on the radio, like mutes now have, there's all kinds of stuff on TV now with, especially late night infomercials, how can I sleep better type things. And it's like, if you just kind of stay up on what's going on, like what's the new on how can I sleep better. If you can relate to that and communicate with patients about that, they know that you're staying on top of it as well. And you're not just trying to stay in this box that you learned one time, and this is the answer, this is going to work for you. It's like, no, but that's not going to work for everybody. Every patient is unique, and every patient needs a unique treatment.
Yeah, I think you nailed it. I couldn't agree more. Organization, that's number one.
Yeah.
Number two, a doctor that's willing to give up some control and let you actually perform and do your job. I think sleep nerdiness or the lifelong learner, you've got to be a lifelong learner. The people that get into this and then fail to miss like every major meeting, I think they're so far behind the curve, because if there's one thing I've learned in all this years of every year, it's something new. One thing we haven't talked about is the financials and the insurance. So how does that work in your practice? Do you do any of that? Someone else handles it? Is it in the operatory? Is it in a financial room? Do you take insurance? Blah, blah, blah. Those types of questions.
Yeah, so we aren't actually in network with any insurance company. We're pay a time of service. which is nice. I know lots of offices aren't like that. So I'm not trying to gloat or anything. But we also, we are partnered with Brady Billing, and they do all of our medical billing for us, which is nice. We just, we have a Google Drive set up with them that we communicate with them with. We enter the patient's name, their birth date. We'd send them a copy of their driver's license and their medical insurance card, and then they do all the work for us. And I know that sounds kind of like, oh, you don't have to do anything, but it's true. You don't have to do anything.
I just remembered something. That was like one of Dr. Rothschild and I's first conversations, because he was having problems with billing. We're not going to drop names of anything.
Yeah.
But I think that was a connection that we made early on, one of our partners in billing, that, people that are not sleep group don't know what we do, but we, the package as it's designed now is education, which we're going to come back to that here in a second, because you're going to step into a new role here pretty soon. And well, you already have, but officially. So we'll make that announcement here at the end as we start to wrap things up. But we've got the education, we've got a returning education visit now. So not just an installation training day one, it's come back in 3 or 4 months when you've got your first 20, 30 cases in motion, and actually get some coaching on what's happening with those patients. Because as much as we'd love to say it's always a slam dunk, it's not. It's a thinking person's game. But a lot of times it is. And so we have to celebrate those successes, and we have to think about the challenges, and we have to sit down and talk. Like I would imagine you and Dr. Rothschild on that admin day have some time where you can kind of brainstorm on some of these patients, in addition to all the tasks that are involved. But the key to the letters is that's required by law for physicians to read. So, if you try to call the doctors, you're never going to get through to anybody. Maybe a nurse practitioner, maybe, someone that's assisting the physician. But to get doctor time is going to be really rare, and to get a call back is probably even more rare. Unless you're on staff and they know, that you're legit. But so we've got the technology. We've talked about that. And we're happy to come out to your office and demonstrate it, or have you join us at a Sleep Group Solutions seminar where you can see it live in person. I know you just came back from a CE event that we sent you out to in Indiana. So did you get to hear Lou Holtz? Like that was like the one thing I was so looking forward to, and then I had to go somewhere else.
Yeah, actually, because of the hurricane that blessed the southern states, he could not get out.
See, it was meant to be then.
Yeah, you weren't there. That's why he didn't show up.
Yeah.
But there's another Lou that works at Notre Dame, and he's the vice president of admissions. And he spoke in his place, and he gave a phenomenal opening speech.
Awesome.
It may not have been Lou Holtz, but it was a really good Lou speech. And he did a really good job welcoming everybody. So it was really inspiring, and he really encouraged everybody to link hands and to unite and to learn together and to continue learning. And I just thought that was so fitting for the sleep community. And I mean, I don't know if he knew the extent of what he was speaking into. I'm sure he did, but it was just so moving to have all these doctors and their team members from all over the country. And here's this Lou that, just last minute decision to speak. And he nailed it. He's like, we all need to be uniting and just educating as much as possible and helping as many people.
I think we all can benefit from like the rah talks. They always hit. It's usually basic stuff, and that's why it kind of melds itself into any situation. I remember the last sleep meeting I went to. That I remember the keynote speaker, it was like Antarctic Mike, and he talked about his trek across Antarctica. I'm like, how is this going to relate to anything? And then I was just like so captivated, and like wore the little strap on my wrist to remind me of penguin steps. A penguin gets across the continent too, but he takes little bitty steps one at a time. And I think that's essential in dental sleep medicine. It's a lot of information. I can recall listening to my first seminar, I was like, oh, there's no way I'll ever remember this. And it's almost like overwhelming, but then now look at us, it's like the back of our hand. We talk about it like it's nothing. And sometimes we have to just take a step back and, realize like you didn't want to get into it, but like all the vitamin D and the B complex and like what ENTs can look at that we can't necessarily look at. But as a dentist or a dental team that's involved with airway, you're part of a team, a healthcare team. Mm-hmm. And I think that's where dentistry has kind of gotten a bad rap early on, is maybe some of us stepped over the bounds and crossed the line into medicine that wasn't cool, And so I think the tides have turned. I've definitely seen the needle swing. I think medicine is being more aware of the importance of sleep. There's certainly plenty of books and podcasts out there, as you mentioned. It seems like you can't hardly turn around. I was like, tomorrow night I'm on another podcast and we're going to talk about more airway stuff. And so there's definitely an awareness out there, but you've done some in-office trainings for us. So do you have any fun stories that you want to talk about that? Or like, what, I think I know the answer to this. What home sleep test equipment is primarily used in your practice? Have you made a switch over the years?
Yeah, we actually started out, I was going to grab it, but we don't have it up anymore. But we started out with the old, the
Watermark
headband,
Aries,
the Watermark unit with the nasal cannula. And that's what we started out with. And it's come so far. Now we're using the watch pat, and it's just so much more convenient for our patients. It's not invasive. It's lightweight, one night use. That's all they have to do it. But yeah, we've come a long ways, and just in 5 years of the Watermark sleep test to the watch pat, I can only imagine what the next 5 years is going to bring. But I definitely, like with the in offices, it's amazing the why story that you get from different offices, and to bring those little stories and tidbits back, or to spread them amongst other people. It's huge. It's just such a great feeling to be a part of that.
I don't think I've ever been in an office where there's been someone that had exactly your situation, where they had no clue that they had a problem, and they're like, oh my gosh, this is me you're talking about. I want to get tested, right? And then
it's like, yeah, and then most of them have children, and they're like, oh my gosh, this is my child that you're talking about. Like I've suffered from PCOS my entire life. And within the last 5 years, those symptoms and debilitating months have actually decreased drastically. So that's kind of my big why story, is to help those young teens who, get kind of sent through the ringer of, oh, well, you'll grow out of it. It's fine. Just take this birth control. It's fine. It's like, well, but what if it's not fine? Like, what if there's other things going on? And like I said, I had been a lousy sleeper my entire life. Like I would wake up and the sheets would be off the bed. I'd be on the floor of my bedroom. I mean, I was just a wild sleeper. And that was the doctor told my parents I was totally fine. There was nothing wrong with me. I was healthy. I did good in school. I was active. There was no like real red flags, other than my menstrual cycle just being horrific. So within that last 5 years, for me, that's my big, I'm like, wow, I can like function every month. I don't end up in the hospital. I can like come to work. I don't have to schedule life around a cycle. So seeing young girls come in and being able to help them kind of get to the bottom of those issues that they've always just been told, don't worry about it. It's like, wow, they can go to college and live a more, and more convenient life. They don't have to worry about planning their life around that.
And what a gift you're giving to those patients to figure it out in that earlier decade of life, versus someone that suffers for decades and probably pays the price ultimately by losing, a decade of life or ending life that isn't of high quality. So are you in an oral appliance yourself?
I am in an oral appliance.
Do you want to talk about that? Like, tell us about which one you use and why you chose that one. Like, who makes the decision? Does doctor make the decision on the device, or does he kind of have a go-to devices that he uses?
We do have a couple like go-to devices that we use. We're really we use can I say a name?
Yeah,
I won't say a name.
Give a family.
Okay, I won't say a name.
Try to keep it neutral.
Okay, we do have a particular lab that we like to use, and we've switched up over the last several years. We started with one particular, we loved it, but just like the home sleep test units, they've evolved. They're sleeker, they're more lightweight, they're more just compatible with different lifestyles for patients, different AHI numbers, different obstructions. So we do have one lab that we usually use. And that's where my appliance is from. I've gone through 3 at this point because I want to try things out. It's like it's like shoes, but for sleeping.
And
So
you guys
it's like,
scan, right? There's no impressions. Your digital scan.
we're all doing scan. We have a CEREC that we use. We do everything digitally. That alone, if you're doing digital models for patients, that you've already won them over, because they're like, oh, I've been dreading doing these impressions all day long. I always throw up. I hate these things. And it's like, well, guess what? We don't have to do that. Like, and your appliance will be here in 3 weeks. So don't worry about that. But usually doc picks the appliance per patient. And then if it's a Medicare patient, of course, we have different appliances that we choose because of Medicare, having different appliances to choose from. So
Cool. And then I promised I was going to get back to the holistic side of it. So how well, maybe there's a couple questions here. So you talked about all new patients kind of go through the airway workup, and I would imagine over the years the existing patient base has kind of made the transition.
yeah.
And maybe you don't know this number of the total patients you guys have there. How many are in an oral appliance? How many are on a CPAP? How many have done other things? And how many have like chosen not to do anything?
Yeah, I would say probably a good 45% of our patients are in some type of oral appliance. I would say probably 20% total have either used a CPAP or they're currently using a CPAP. I would say 5% of them actually like using a CPAP, like, which is good. That's a good number. That's for CPAP. That's good. So I would say
we're neighbors, and so like I know you personally, and I know we're an outdoorsy community here. Mm-hmm. So you're not going to take your CPAP down the Grand Canyon on a 7-day float or raft trip, right?
Yeah, no, absolutely not.
I take my stand-up paddleboard. Like you do some pretty wicked stand-up paddleboarding too, I've seen.
Yeah. My appliance goes with me down every river trip. Like I'm like always like scrubbing it over the river and cleaning it in the mornings, and like it goes with me everywhere. It's.
We need to make one that floats. That's our new design. Like you heard it here first, folks. Glow in the dark. That was always my why don't they glow in the dark? And then for the water people, why don't they float?
Yeah, we do need them to float. So if there's any lab listening, love an outdoor extreme oral sleep appliance that floats and doesn't get melted in the hot sun.
Yeah, but let's go back to the holistic thing. We'll kind of wrap up there. Maybe 5 minutes on. I think we've talked about color therapy in the past. You brought up aromatherapy. So give us like your top 5, top 10, whatever tips that you kind of find your go-tos with patients when they're asking about it, or do you talk about it openly, or do you ask, would you be interested in knowing, what you can do? Because Colorado, like a land of fruits and nuts, right? So maybe not everywhere is like us out here. But, our
office is completely holistic based. You can see the color of the wall behind me. Everything's color and color therapy in the office. So every patient gets holistic treatment. We're treating the patient from head to toe. We want to know as much about this patient and their health history as possible. We always tell them that we do want to know everything about them. We're not just here for one a la carte tooth that's going to be a problem and then send them on the way. We want to have a full comprehensive approach to their health, not just their teeth. So when they come in, we do have aromatherapy going in the office. We do have color therapy that we use. We have you have to have eye protection in the dental chair. So why not, cross connect it with color therapy? So we have blue, purple, green, red, and orange, different colored glasses that the patient wears while they're in the dental chair. The patients love them. We've actually had a patient who had tremors really bad and we put red glasses on him and he stopped. And that was something, and he had tremors for years. And so that was something that we got to kind of discover for him. And he went out and we gave him those red glasses. We're like, you can have these, take them home with you. And he wears red glasses now. And it's helped his tremors drastically. But the purples and the blues help with relaxation, promote healing. When they're in the dental chair, Dr. Rothschild will even place acupuncture needles for patients who are really apprehensive or very nervous, which is a really nice touch in the dental chair while they're here. Treating sleep and airway has definitely been our biggest approach of holistic, I feel like. We do all of our materials we use are biocompatible with the human body. Doc does a lot of research on every individual material that we're using, down to Gluma to Bond to Grandioso, like whatever materials we're using, he's done an extensive amount of research. Like I said, the man's a walking encyclopedia. He likes to learn, which is, there's nothing wrong with that. Our patients love it. They know that they're coming here and they're getting the best of the best for their health. So yeah, that's kind of our holistic approach.
Awesome. Thank you for that information. So I guess we'll make the big announcement. You're joining the Sleep Group Solutions team as one of our educators, and you're going back home, right? It's Oklahoma's home.
Yeah, Oklahoma's home, Grand Lake,
Oklahoma. So
yeah.
you will be touring the country, doing in-office education and installations and helping with seminars like you've done in the past. So
yeah.
Do you have some goals? Like what are you hoping to achieve with this journey as a educator for Sleep Group?
Yeah, my big goal is to definitely just spread sleep education to the northeast corner of Oklahoma. It's rural communities out there. IHS, which is Indian Health Services, is it's free healthcare for those who have Indian cards, which is great, but sometimes it's not the most up-to-date healthcare. So that would be one of my biggest goals ever, to introduce airway concepts to that community, to those communities. They're rural communities, so be able to help children at a young age. I just that's kind of my big tear jerker. I want to help all the children. Like I said, I had PCOS, so I'm unable to have children. So the kids in our practice is that's my I just beam when they come in and I see them change for the better. So that would be my biggest goal, is to spread Sleep Group Solutions to the rural communities of the Midwest, but also just to help Sleep Group kick it off to the next level. I know you guys have been doing so much work. You've been restructuring the education and how you do seminars, and this new seminar, the in-office seminars that you guys are doing, and the follow-up education after getting into the program. I'm where was that when we started? I can't imagine where we would be 5 years now if we had that structure set up. I'm super excited to be a part of all of these offices' new journey, to watch them blossom and to help with just educating and learning right along with them. I'll be a forever Rothschild student, and I'll be forever learning. So that's never going to change.
The man looks like Albert Einstein's brother. That's what I always say. But anyway, he is a brilliant doctor and he's a good friend. And we can get a crowd excited in a weekend, but it's inconceivable to think you can learn what you need to know in a weekend. You can learn enough to get started, certainly. Yeah. But really the way the program's structured now is let's just hold their hands for the first full year, get this thing off the ground. Because anytime we start something, and change is always difficult, but anytime we start pushing a cart up the hill, it takes more energy in the beginning. It's a lot of setup. Even after a client comes on, it's a huge setup process. And it's sometimes I just want to go. They're so excited to help these patients. And you can't look and not see somebody that has airway distress. It's just, you can't go into public. I see him in the grocery store. I see him at the airport. I see him stopped at a traffic light. I'm honking my horn, wake up, idiot, let's go. But it's endemic, for sure. And like Durango's the big town around here, but it's rural. And you're not the only show in town over there. There's other dentists that are doing dental sleep medicine, and there's plenty of patients to go around. Like that's a myth out there that I want to be the only one in town that does it because there's just not going to be enough patients. That's baloney.
Yeah.
We as dentists all do crowns and implants and fillings, and there's plenty of patients for that. So I would encourage anyone that's even got a remote interest, just do it because the program, the way it's set up now, is going to produce a return that's almost inconceivable. And so I really appreciate you jumping on with us tonight. I'm excited to see what your future holds. And I know Doc's going to miss you with all of his heart over there.
Yeah, it's been some tears over this.
Yeah. I can only imagine, but you know, our practice family is just that we spend more probably waking hours with our work family than we do with our family at home. And so welcome aboard. And we're excited to have you join us. And, you know, as always, reach out to me. I'll put, I don't know who's on here, but I can put my content up. If Faustina, if you want to bring the message back up, I'll throw my information in the chat here. So Jay Harrison at Sleep, what's my cursor? Sleep Group Solutions with an S.com. I'd be happy to reply to any emails that want to come in if you've got further questions about tonight. And I can forward some to Bandy. I know your email's still getting set up, so we're not going to throw that out there yet. But hopefully we can see some people in Vegas, DC, Dallas, Hollywood, or LA. And 50% off the seminar, Sleep TV 50. So good night, everybody. Thanks for joining us, Bandy. I look forward to catching up with you real soon in person and not over a Zoom meeting. So
that sounds good. Thank you so much for tonight. Appreciate it.
My pleasure. We'll see you later. Bye-bye.
Bye.